Let's talk about immunity. Now, Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter Medical School, with over 20 years of experience in communicable disease control, and also infections too within the community. And the looming long COVID concerns and the importance of getting vaccinated in time, and how to build up a strong immune system to come back fighting against the disease is what it's all about. Now, Dr. Pankhania will also help us to answer any lingering doubts around COVID vaccines, and also their relation to fertility, as he sets out the long-term goals for society as we look beyond COVID in this session, which is called Beyond COVID. Let's talk immunity.
Tony, thank you very much for that wonderful sort of insight into the iGlobal Great Indian Wellness Show, where 2 days of talks of course, insights and information and well-being of Indians. Today, you're joining me with Sanjay Rugani, Study Professional Finance, in conversation with Dr. Bharat Pankhania, who is a senior clinical lecturer at the University of Exeter Medical School. Dr. Pankhania qualified from the Welsh National School of Medicine, Cardiff, Wales, and trained as a GP in 1989. Thereafter, he did further training in respiratory medicine, having had experience of both primary and secondary care. Dr. Pankhania realized that to make a bigger contribution to people's health, primary prevention of illness was important. Thus, he trained in public health medicine and thereafter did further training in infectious diseases and communicable disease control. He worked as a consultant in communicable disease control for local authorities, the newly created Health Protection Agency, and subsequently Public Health England. Welcome, Dr. Pankhania.
Namaste. Namaste, everyone.
Namaste. So let's get through this next 20 minutes. We are going to be short of time, as you know. COVID cases, infections on the rise, over 50,000 in the last couple of days being noted. Albeit the death numbers are lower. Your thoughts around that?
So whilst we've got for about 52% of the entire population, not the adult population, immunized, we've got 48% yet to be immunized. And in the background, we've got a more infectious variant, the Delta variant originating from India. And we've got a dropping of the guard with respect to moving all restrictions on the 19th of July. And not only have we got removal of restrictions, but we've got removal or personal infection control measures rather than mandatory infection control measures. So we've got a perfect storm brewing. And as an infectious disease expert, I worry about the large number of cases that may be generated. I appreciate people will say people are not dying, but with a large number of cases generated, inevitably some people will die. And more worryingly for me is these are younger aged people who may, after their infection, go on to develop long COVID. So if you are at risk of having long COVID, and we don't know who is at risk, but people post-infection, about the range is between 5 to 15%, 20% people develop this thing called long COVID. A small percentage of a very large number is a large number of people who we may have to deal with long COVID, and they cost money as well. So I am a bit concerned.
So just going back to your long COVID point, we don't seem to talk much about it. The government doesn't want to talk much about it. NHS is not even sort of communicating this. How would you go about potentially trying to alleviate some of these long COVID factors? And in particular with the Indian diaspora, what do we need to look out for? What should we do?
Well, long COVID appears to be an autoimmune disorder in that it is after the infection, your own antibodies, your own immune system is triggered to attack your own organs. So you get an attack upon your heart, your kidneys, your gastrointestinal system, your brain, and you're left with a range of signs and symptoms ranging from heart palpitations to the kidneys not working very well, to your brain not being as sharp as it used to be before, and extreme general tiredness. It's a range of vague, non-specific signs and symptoms. Having said that, researchers have recently identified that there are some specific antibodies in play, and therefore we may be developing a test to identify long COVID going forward. The thing is, we don't know how to treat it, we don't know how to manage it, and to treat it and manage it, we need multidisciplinary input. So just because your heart is giving you palpitations doesn't mean you only need a cardiologist. You also need an immunologist to suppress these antibodies, which are harming your heart muscles, which are causing the palpitations. So just treating the palpitations per se doesn't mean you get rid of the problem. The problem may go to other organs. So we really, truly need a multidisciplinary approach to this. And in my address to peers at the House of Lords, I said exactly this, which is it isn't good enough for an individual symptom to be treated for long COVID. It has to be a multidisciplinary approach to managing this new thing called long COVID, because it appears to be an autoimmune disorder.
Just to add to that, then, some of the symptoms you mentioned, the diabetes, the heart palpitation, etc., this is very prevalent in our Indian community. What should they do if they've got a mixture of these? Because there's clearly going to be a concern around people, with these certain ailments that they have.
Well, it's a perfect storm, and a very unfortunate perfect storm, because a lot of our Indian diaspora are also living not necessarily in affluent areas with good provision of GP practices and NHS services. It is a fact, and it's an elephant in the room which we don't like to properly address, which is if you're living in a poor part of the country, you get poor healthcare services. It's a fact, it's knowledge. So I feel very sorry. I wish to have platforms like this to inform, educate, empower all people, not only the fellow Indians, but all people, all races, all cultures. I want to empower them to get better healthcare in their locality. It's very hard because in a poor place, you get poor services. What can you do? There isn't a lot apart from you being persistent, meaning what you have to sort of articulate. It's the way you articulate it. So you have to articulate it like this to your GP. Doctor, these signs and symptoms I have are new. They're unusual for me. I have never had heart palpitations before. I had my coronavirus infection, and after my coronavirus infection, I continue to have these heart palpitations, or I continue to have this brain fog. My memory is not as good as before. I want you to take note of this. I know there isn't much we can do right now, but I would like you to at least put me on a register that I may have long COVID, and I would like an early, timely referral to multidisciplinary teams to look into me.
You mentioned, and that's a valid way of looking at it, but number 2 points I'll bring to that. GP appointments seem to be infrequent at the moment, number one. Number two, you mentioned that these aspects were mentioned in your discussions with the peers in the House of Lords and the committee. What was their thoughts on it, and how do you get an appointment referral at this level? Because clearly at the moment our resources are being used to fight COVID rather than even consider the long COVID effects.
Yes, it's a mountain to climb, but that doesn't mean you don't climb it.
Absolutely not.
I was extremely welcomed with my comments and suggestions, and I hope that they are being listened to. Remember, when I give advice, the advice is heard. I have no idea what happens to the advice afterwards. It's a one-way thing. So I give my advice freely to anyone who will listen, and hopefully it will be acted upon. So
indeed,
considerable investment.
So your suggestion on long COVID is to get in front of a medic and get it registered and do something about it as soon as you feel some of these symptoms coming ahead, right?
Yeah, so I would say to people is because you do get resistance uh, from when you talk to your GP, etc. Is my simple advice is rehearse what you're going to say, and then rehearse it again, and have a clear mind, a clear expression, and then go to your GP and say it with a clear, practiced mind. I have this problem. It's a new problem. It's a persistent problem. It's not going away. It is after my infection. I would like you to look into it, and I don't really want you to dismiss it. You need to be firm. You need to be
Perfect.
clear in your expressions.
Going back to vaccines, you mentioned 52% of the entire population has now been vaccinated, and I believe that's with both first and second shots as well. But there are concerns of the Delta variant, whether it's effective against it. The AstraZeneca the vaccine that was made in India, there are certain considerations being discussed around that, whether it's effective. We also had yesterday announcement that people coming in from France, for instance, a local European country, now need to quarantine for 10 days. Are the vaccines really that effective? Should those that haven't taken it, for the fear of not taking it, should they take it, and so forth? Could you perhaps give us a little bit of an insight into that aspect, Dr. Pankhania?
Yeah, so your line should be vaccines prevent you from getting severe disease and dying, and they do that very well. So don't look at it as the benchmark of do they prevent me from getting infection, mild or moderate. What you need to look at is, does it prevent you from getting severe illness, which stops you from going on a ventilator and not coming out of it? Yes. So they are effective in preventing severe disease. Go and get yourself vaccinated. With respect to control measures, albeit late, albeit very late, we are now waking up to stopping the reintroductions of variants which may be more infectious, may bypass vaccines, may cause more severe disease. We should have acted fast, hard, promptly for India too. We didn't do that by putting India on the red list immediately. So I welcome these control measures. They're not 100% watertight, but at least they slow it down rather than, it's better to do something rather than to do absolutely nothing.
Thank you on that. So looking forward, vaccines again, we talk about fertility. What are your views around that?
Oh, absolutely. And it's a great pleasure to have this platform to dispel myths. And the vaccines do one thing, and one thing only. They make spike protein against which you make immunity and you make immune memory and you're protected. The mRNA that we inject into your arm, the mRNA is a code for making spike proteins. That mRNA does not interfere with your nucleus. It doesn't interfere with anything. It comes, it goes, it makes spike protein, finish, no more, no less. So does it affect your fertility? No. Does it affect your unborn child? No. Does it affect you in your breast milk? No. Does it have any interferences with future fertility? No. It is a very simple, straightforward, pure vaccine. It comes, it goes, it does its job. I hope I can reassure you that there is no interference with your fertility or whilst you're pregnant in utero to the baby or whilst you're breastfeeding your baby. None, none, and none.
Thank you for that clarification. I think it's very important, particularly with the younger generation that are still concerned. And I don't personally believe that there has been a message out there to the point of it does not affect this. I know I've also done a similar discussion like this on fertility in the past where similar messages were given out. But I think in the larger format of the NHS and the government, not enough is being done. Looking forward then, Freedom Day. You and I conversed similar conversations 6 months ago in January when we were just going into lockdown. We're now apparently coming out of lockdown. A lot of concern back then. I guess there's still a fair bit of concern right now. So Freedom Day next week, what is your advice around face masks, social distancing? And would you say the 3 C's that you shared with me on that occasion still apply today?
Yes, so I want you to look at this as a complex game of chess, and your objective is to remain infection-free and alive, because better days will arrive, and for better days, you need to be in good health and you need to be alive, obviously. So you play this complex game of chess to not get infected, not infect others, and wait for better times to come. How do you achieve that? Well, observe the Far Eastern method, which is the 3 C's. Avoid getting close, close to other people that are not in your network. So that's one. Avoid crowds. So crowds of people, avoid them. And number 3, the other C, is avoid closed spaces. So you avoid closed indoor spaces with poor ventilation. If you do those 3 C's, plus you wear a good quality mask, and I advise wear a FFP2 mask. So I would like people to give up on this surgical masks that we've been wearing lately. They're good, but they're not as good. So in line of the more infectious Delta variant we have, it becomes more infectious. We improve our mask quality. So I want you to go and buy FFP2 masks and wear it properly. Wear it properly, important. And that is not an absolute protection, but it is slightly, marginally better protection than this. So do the 3 C's, wear a mask properly, wash your hands, and don't introduce infections via your hands to your nose and mouth. That's all. It's not rocket science. It's simple things, very simple things, and good times will come.
So putting that into context of the Indian diaspora, we're opening up, wedding season, you know what's going to happen. You know what I'm going to say. You know, you're suggesting avoid crowds, closed spaces, closeness. It goes against the grain. How would you actually push that message forward more than what you've just done now? And what should we do, essentially?
Well, as I said, in using the metaphor, this is a complex game of chess to play, and the end objective is remain alive and infection free. So if you are in any vulnerable group, or you have other underlying conditions, your older age, etc., you know, above 60 is a danger age. So I would say avoid all those 3 C's, and you will have to give your profuse apologies and say, I can't come to the wedding. You have to be brave. You need to be alive. If you're dead, you will never see the products of that wedding. You know, the happiness, all those things, the children that come and the family that gets expanded. None of that you will be there to see and enjoy because you went to one wedding. So play that game of, I can't come today, but we will have better times tomorrow.
Are you there? Dr. Pankhania, thank you. So look, we're coming to the end. Thank you very much for your insight and wisdom into this area. To conclude, your key message in a sentence, please.
Don't drop your guard. Get immunized as soon as possible. Wear your mask properly. 3 sentences. But first point, don't drop your guard.
Thank you. Thank you. So you've heard it here at the iGlobal Big Indian Wellness Show with Dr. Pankhania. Remain within the 3 C's. Avoid crowds, closed spaces, and closeness. Wear an FFP2, I think you said, wasn't it? FFP2 yes. Mask. And ensure that on the so-called Freedom Day, you still maintain that social distance and all the preventative measures that we've been taking for the last 18 months. Dr. Pankhania, thank you very much again for your time this morning, and I look forward to seeing you again.
My pleasure. Thank you. Namaste,
Thank
everyone.
You. Namaste.